Good afternoon. Thank you for joining us again for the next update of the weekly financial meeting. Just as a few house reminders regarding the meeting before we get started, if you hover your mouse in the center of the screen, you have the option to mute yourself, your audio, and stop video. So we recommend that you do that during the presentation, especially if you don't want to be part of the recording. This recording is, as I said, being recorded and will be posted to our website. Everything that's in the chat box is considered part of that recording as well too. So just as an FYI, feel free to mute yourself when you're not presenting. Shelley will be presenting our materials. Thank you, Shelley. So there's no need to screen share for the presenters. *6 to mute yourself if you have any questions. So we have a bit of stuff to go over today. A lot of it has been presented before. It's just updates to items that we have presented in previous presentations. The only item that is unique to the agenda that's never been mentioned before is the update to FEMA's Public Assistance Program and Policy Guide, or PAPPG. So that was published on June 1st. Why does it matter? It matters because this is superseding the former version of the PAPPG. And this is applicable to all emergencies declared from August 23rd, 2017 through May 31st of 2020. So that would encompass the new pandemic that's been going on. So something has changed. It's a very lengthy document. Whoa. It's just a brief reminder to mute ourselves. Someone might have two screens going at the same time. So something in this PAPPG has changed since the last version that was released, but is a very large document. So what that change is, we don't know at this time. Hopefully that guidance will be presented soon so that we can provide more guidance regarding what changed between the previous version and today's version. SBA, we do have an update regarding the Payroll Protection Plan, PPP. The Flexibility Act was signed into law on June 5th. And is citing that for the PPP, 60% of that amount borrowed must be spent on payroll. Previous drafts had that at 75%, so that has changed. This PPP program is still being forgivable, and it's being extended up to 24 weeks versus 8 weeks. So if you haven't applied for the PPP yet, you still can. You need to be approved by a lender by June 30th, which is quickly approaching. SBA's website does have a list of the different lenders who are approved to submit the PPP on your behalf to the SBA. So unfortunately, we can't assist you with finding which specific lender you should go with. There's really not a should, it's just a lot of different lenders, and you'd have to go one at a time to see who could process your application for you. EIDL loan, the economic injury disaster loan, is still taking applications. This is not a forgivable item, just like the PPP. This is different. You will have to pay this back, but it is 3.75% over 30 years. They are still taking applications. So if you would like to take that opportunity, feel free to to take that hyperlink and submit an application. The Economic Injury Disaster Loan Advance is taking applications. What is that? That essentially gives you the funding that you would need to kind of bridge over from when EIDL funding comes in. So essentially it's a mini loan to kind of help give you funding between that EIDL funding officially, so that you don't run out of cash flow if you need that cash flow being infused. So that's what that advance is. Excuse me. All right, the next thing is the COVID-19 cost recovery for fire and EMS departments. This is through FEMA. We actually presented this, item C, on our first presentation way back when, but back then it was a lot of, this is here for you, follow up and get information. Now it's a lot more streamlined. So on the far right-hand side there, the COVID-19 FEMA reimbursement for costs and medical services, there's a flyer there that gives a bit more information regarding different expenses and items that would be eligible for cost reimbursement. Now remember, FEMA does have a cost share, so that has been appealed to be waived, but we haven't heard back as to whether or not that was ever approved by the federal government. And there on the left-hand side, it says download public assistance application. This is new as well too. So if you click on that, if we can go to click on that, that has a lot more streamlined information than we were first provided when we first started doing these conferences. So there's a lot of information here, hyperlinks to guidance documents, FAQs, and a lot of different tutorials regarding how to fill out this application. So this is new regarding funding source that we had previously presented. We wanted to submit that information to you folks. And we have direct hyperlinks to that reimbursement flyer and that application on the agenda. So feel free to use those instead of having to go through the different steps that we just did. CMS has updated its FAQ. So if we can click on that FAQ resource, essentially the ambulatory items are on pages 30, 32, and 33. And on page 30, the change to the FAQ was regarding section 6002 of the Families First Coronavirus Response Act, or FFCRA. We can get page 30. Essentially, it's talking about cost sharing under Medicare Part B, and it cites a billing guidance stating that essentially ambulatory providers are not applicable to that. So that's what question that first item 6002 on page 30 is regarding. If you skip down to page 32 of the FAQ, it goes into the ambulance data collection and reporting requirements for year one for the Medicare ground ambulance data collection system. It's a mouthful. So essentially, CMS is trying to gather information regarding the reimbursables to evaluate how much ambulatory providers are being reimbursed and if it's appropriate or needs to be changed. A lot of people knew about this different research that's going on. Not everyone was chosen. So essentially this guidance on pages 32 and 33 of this FAQ is essentially stating that there's going to be some changes regarding to how that is completed. Year one was supposed to be this year, calendar year 2020, but obviously given the nature of what's been happening, they're going to be changing some of those items. So if we can go back to the, agenda, please. There's that hyperlink, the data collection and reporting requirements in II. If we click on that, and this is in the FAQ, it can guide you there as well too. This is a new website essentially stating that CMS is going to be changing the dates for that data collection from 2020 to 2021. And that FAQ is essentially stating that previously people had a choice as to whether or not they wanted to continue with 2020 or switch to 2021. And from my understanding is now you don't have a choice. Now we have to switch to 2021. So does this affect everyone? No, this only affects the persons who were chosen for this research guide and this research model. And on the agenda, I have a list of everyone of who that is. So if you see your name on that list, and you are a member of that list, then you probably want to consult the contact information that's on that website that we just saw. There is a contact information there, or read the FAQ. If we can skip to that last website we were on, Shelley, real fast, that would be awesome. You have that tab open, yeah, right there. If you scroll down, keep scrolling, there on the right-hand side says contact such questions. There's a CMS regional offices there and office contacts. So you can use that information to contact someone directly if you want to clarify something that you feel is not clear in the FAQ or in this new web page that's been presented to us. So that would be interesting to see what happens regarding that. And with that, let me hand it off to Jason, who was kind enough to present this topic for us. Since I was running horribly late on this agenda, I deeply apologize to everyone. Jason, if you could.
All right. Thanks, Catherine. And first of all, I'm going to come clean because that feedback was from me. I jumped off as soon as I could, but I'm technologically challenged today, apparently. I am phone only. So, Shelley, I'm not going to get too complex with navigating, but if for some reason you're lagging behind, give me a shout out and I'll hold off. But the areas I've been focusing on most weeks are related to the CARES Act Provider Relief Fund. Typically, I've been focusing on the $50 billion general allocation. Just recently, CMS announced that they were, or I guess I should broaden it, HHS has announced that they are starting with some of the targeted allocations. The first one is a $15 billion allocation to eligible Medicaid and CHIP providers. So on the agenda Catherine has linked there 2 upcoming webinars regarding this allocation. And those to register, once you click on that link, it lists first thing at the top of the page, those 2 webinars. And the big question is whether those are applicable to ambulance providers. It does not appear that they are, but because it's not concrete, and because I know some providers have other lines of business under different either tax ID numbers or NPIs, we wanted to get this out to everyone to see for themselves. So anyway, I encourage everyone to register for one of those webinars. Also on that same web page, if you scroll down, the second, they kind of revised their website again, trying to make it a little more user-friendly, I guess. But the second, I guess, box or icon there says about the Provider Relief Fund. That provides a pretty good overview of both the general distribution and then these targeted allocations. In that second box down there, they have the Medicaid and CHIP distribution, and it says here providers who bill for Medicaid and CHIP and did not receive general distribution funds. So most ambulance providers did receive general distribution funds. Those are the ones that in early April were automatically deposited to our bank accounts. But again, there's a lot of moving parts to this, so I encourage everyone to watch one of those webinars. The other thing, real quick, and Catherine, I'm sorry I didn't bring this up before, but overlapping this meeting right now is a American Ambulance Association webinar. It's a financial relief update and guidance for the second stage of the pandemic. So they might cover some of this. For myself, it's sometimes easier just to watch the recording. They almost always put the recording on there. So just a heads up that everyone should watch that. If for some reason you can't, at least I will be watching it. Some others who have been leading these calls will watch it and fill everyone in at our next meeting. Absent any questions, I think that's all I have.
Yeah, awesome. I'm glad that we'll have some more, hopefully, information from that webinar. Thank you for that. I appreciate the information about that. Star 6 to unmute yourself if you have any questions, or I don't see anything in the chat box.
I don't either.
All right. Well, today was a quick update since a lot of this we've presented before. So thank you so much for spending some time with us. Again, all presentations, agendas, and resources are posted on our Grand Ambulance webpage. If you haven't signed up for the free decontamination through Battelle, please do. That's offered through November. And then, of course, ADHS has its own EMS and 911 resource page. There's the hyperlink for the COVID pages in Spanish. And if you have any specific EMS COVID questions, feel free to email those directly to emscovid@azdhs.gov. Well, thank you so much for everyone's time. Thank you, Shelley. Thank you, Jason, for being available very last minute. Again, this was unexpected. We didn't expect anything to be this week, and then all this stuff came down. So thank you so much for being available. And if you have any other questions that we haven't addressed regarding this information, I'd be more than happy to try to help people out. Go ahead and email me directly if need be. Thank you so much. I appreciate the thanks. Yes. Thanks to all of us. We all work very hard for this. So thank you. Have a great week, and hopefully we'll talk